Hello, my name is James Crick, and I'm the course director for the CareStream student program. CareStream is an immersive experience in healthcare delivery and improvement and is an undergraduate course for health science students. CareStream was originally conceived of and developed in 2022 and originally rolled out in early 2023. The intent of the CareStream course is to connect interested undergraduate students who have professional healthcare aspirations. So perhaps you're interested in becoming a physician or a physical therapist or a nurse practitioner or physician assistant or some other professional in a healthcare setting. One of the challenges that this course intends to address is getting hands-on and face-to-face interaction with these types of providers in real clinical settings to see what those jobs look like, what those experiences are for those clinicians. Simultaneously, the intent of CareStream was to help students to provide support to these important clinics within our own healthcare system at Ohio State University Wexner Medical Center. So the aim for CareStream is to connect students into meaningful roles in order to help operations within our healthcare system, allowing for improved understanding of students for their future healthcare aspirations. Here's a couple of pictures of students from our original cohort in the spring of 2023, providing assistance to some of our patients within our hospital system. Here's a quick view of our CareStream team. We are led by Dr. Katie Quatman-Yates and Dr. Carmen Quatman, and there's quite a number of us who help to run this program. This program has been successful in how it's been rolled out thus far, and we feel like we're just beginning to scratch the surface of the potential. You can see that students have reported that they feel like this has helped to solidify some of their perceptions of what they thought their future might look like. They feel like it's helped them to become more comfortable with communicating with patients and with providers, such as physicians, nurses, and physical therapists within the dynamic healthcare setting. They also feel like it helps them to understand our healthcare system better, recognizing that there are problems sometimes that need help to correct. This course is structured in such a way that all students who enroll for the first time are required to take 2 total credit hours. One of these is an asynchronous course that is provided on Carmen that you complete on your own time. Topics for the asynchronous course include such topics like safety and professionalism, being able to understand the healthcare system more fully, social determinants of health, insurance, health equity, those sorts of topics, in order to create a holistic understanding of the healthcare system, hopefully in a way that is engaging. The second credit hour is an experiential learning credit hour. And this is a little bit more focused on providing clinical services in tandem with, shoulder to shoulder with, our current clinical staff at The Ohio State University Wexner Medical Center. One credit hour of experiential learning requires at least 45 hours of clinical commitment over the course of a semester, which in the spring and the fall terms is about 4 hours per week. Some of the opportunities that may be afforded to students when they're in the clinical setting include helping to provide assistance to patients within our emergency department or on various hospital units, or perhaps at Dodd Rehabilitation Hospital. They provide unskilled clinical participation. They support our healthcare providers in the provision of healthcare within our own hospital system. It also helps to provide, hopefully, some contacts for additional shadowing opportunities, or for a better understanding of what the day-to-day outlook or day-to-day process is for whatever the healthcare profession is that you are considering. And we also provide some instruction in things like quality improvement and hospital operational excellence. So how do you enroll? Beginning in the spring of 2024, we will have a new course number, which is HTHRHSC 4191. And our course title will officially be CareStream, an immersive experience in healthcare delivery and improvement. This course is offered on a first come, first served basis. Now, there is the potential, because we are updating the course number, that it is not immediately live for the very first people who are enrolling. I encourage you to work with your academic advisor and continue checking in, as it should be up and running as soon as we can get it through the student information system. So there is not any need for any of our instructors to approve your enrollment. The way that it will be structured is that you enroll in the asynchronous portion of the course, and then you select a recitation. That recitation will correspond to your clinical hours in the following term. Now, it is important to note that enrolled students, prior to beginning in the healthcare setting, they will be required to provide evidence of immunization history, a drug screen, a negative TB test, and a background check and fingerprinting. The background check and fingerprinting occurs at the Ohio State University Wexner Medical Center in their ID processing area. So far, we anticipate that our spring 2024 offerings will be as you see on the screen. So we will have a footprint in the clinical setting Mondays through Thursdays with various offerings during daytime hours. We anticipate at least being in the hospital emergency department, several of the inpatient units across University Hospital and the Brain and Spine Hospital, Dodd Hall Inpatient Rehabilitation Facility, and potentially several others. If you have any questions about this course, I encourage you to speak with your academic advisor. Please don't hesitate to reach out to me or to some of our other individuals, including Katie Quatman Yates. You see both of our emails there on the screen. We'd be happy to answer any questions that may come up, and we hope to see you in this course sometime in the future.